Welcome, everyone. It's so great to have you here on this beautiful last day of May. I'm Velin Hawkins. I'm Dr. Akil's Marketing Director, and I'm excited about what we're doing today because Dr. Akil does not have a presentation like he normally has. He's just got some great information for us. And I always felt like it was funny when you hear people talking about their belching and their burping and their farting. And um, now to know that there's a reason behind all of that, and that reason is something that we can take control of and even change. So, welcome. Glad to have you here today. We all know Dr. Akil, but in case you don't, he is a practicing physician, septuagenarian athlete, and an all-around really great guy who is doing some amazing things in the world, speaking all over the world, from London to India to California to the all around the US, conferences, groups. And if you know anyone that needs a speaker that speaks about this topic, and this topic being health using a whole food, plant-based diet and the 6 pillars of lifestyle medicine, think about Dr. Akil. He would be great for that. And I'm not going to take up any more time because it's important for us to get into this topic today of acid reflux. If you've had any questions about why does it happen, it hurts, it doesn't go away, I have to take this thing and that thing in order to kind of quell the burning, this is where those answers will come. So thank you, Dr. Akil. I'm going to turn it over to you. I'm going to make you center stage, and I'm going to let you tell everybody what we're going to do.
Okay, so since my computer has died on me, we are not having a presentation, a slide presentation, and we are going to have a sort of a question answer. Lynn will ask me what she wants to. At the end, the audience can ask me what they want to. So we'll go that way so everybody will be involved at the end of this talk. I wanted to start off by saying, what is acid reflux and how does it lead to damaging the food pipe when we call it the gastroesophageal reflux disease? Now, I want basic understanding on this. You have the stomach and you have the food pipe, which is esophagus. Now, the stomach, the inner lining is such of the stomach that it can handle acid. Not only that, acid in the stomach is required for a lot of things, good things to happen to your body. While acid, if this acid goes to the esophagus, the food pipe lining is different. It cannot handle this acid and can cause problems in your food pipe. That is when you start getting a burning sensation in the chest, when the acid from the stomach goes to the food pipe. And then this is your acid reflux. When this is an ongoing process for weeks and months and years, then you start getting inflammation of the food pipe, causing gastroesophageal reflux disease. So let's go on to the next question or whatever you have, number 2.
Okay. Is you kind of mentioned it, but is acid necessary in the stomach and why?
Okay, acid in the stomach is necessary because acid in the stomach helps with your digestion. It breaks down foods, particularly protein, in smaller particles. It also helps in the absorption of nutrients like your vitamins, B12, iron, calcium. And this acid is a barrier against harmful bacteria that can cause problems to your health. So make no mistake, acid is not required in esophagus. Acid is necessary in the stomach. So next,
Next is acid reflux common in the US?
boy oh boy, 15 million people suffer from acid reflux in the US. And let me tell you something, this is an underestimate because all the medications which are prescribed are also available over the counter in smaller doses, but the medication is the same. So you have about 50, 50 million prescriptions a year written on this antacids or H2 blockers like your Pepsid and Exid, your proton pump inhibitors like your Nexium, Prevacid, Prilosec, and the antacids like Mylanta, Tums, Roleds. These are taken like candies. People just pop it in the mouth as and when they require. So there is an evidence that you can have serious side effects with long-term use of these medications, which we will go into it. But I believe that it has become such a huge problem that people are taking it for years and years. When in my
Mhm.
the the best scenario is that even if you have got heartburn, acid reflux without damaging the esophagus so far, then you can take once in a while, or you take it for about a few days, a month maximum, but not continuing. I've seen people take it for 15 years, 20 years ongoing. And that's
Mm.
where the problems are.
Mhm.
Now, most people can manage the discomforts of acid reflux and GERD with kind of lifestyle changes, which is the most important thing,
Mhm.
and
Mhm.
more important than medications. And then in some rare cases, very rare cases, say, for example, you may need surgery, like if you've got, say, hiatal hernia. That means your stomach has come, the top part of your stomach has come through the diaphragm above, causing pressure and causing the acid to go into your food pipe. You may require surgery at that time.
Wow. That brings up a really good question next, about the cause and the common causes of acid reflux.
I think before that, let us talk a little bit about the symptoms.
Okay.
Let's
Yes. Yeah.
understand what symptoms are. And the common symptoms that we always talk about is a burning sensation in the chest, which is often called as heartburn. It usually happens after eating and might be worse at night or when lying down. Now, I don't know about you folks, but I have already had this experience. Sometimes way in the past, when I used to have large quantities of food, at bedtime and go to sleep immediately, I would get a backwash of food or sour liquid in the throat. And that is a time you feel so heavy in the chest and you want to throw up and you're nauseated, you're getting a chest discomfort, the upper belly is hurting. Uh, Sometimes you may get trouble swallowing. So this is what we call as dysphagia. And at times you can have a sort of a lump in your throat. And that is kind of sensation that you want to do something immediately about it. Now, if you have nighttime acid reflux, then you may also have an ongoing cough. And if it is affecting your airways, this reflux, this acid, in some ways with your vocal cords, that means your voice box, then you can get laryngitis, which is inflammation of the voice box. And then what the end result is, you will have kind of hoarseness of voice. And then if you've got asthma and the acid reflux is going that way, then you may get worsening of this asthma. Now, as Lynn asked me, what is the common cause? Why all this? Why is the acid going up? Why can't it remain in the stomach? So let me explain to you. See, when you swallow, there is a circular band of muscle around the bottom of your food pipe, the esophagus. This band of muscle is called the esophageal sphincter, which does its job beautifully. It relaxes to allow food and liquid to flow into the stomach, and then the sphincter closes. Now, if the sphincter does not relax, as is typical for it to happen, or it weakens, then the stomach acid can flow back into the esophagus because now it relaxes when it is not supposed to relax. And then this constant backwash of acid irritates the lining of the esophagus and causes it to be inflamed. So, understanding this is very important because the moment you realize that this is what we call LES, lower esophageal sphincter, the problems with this sphincter can cause all the problems. So, when we go, the next point would be, so we know the symptoms, we know the cause. Why does it happen? What are the risk factors? So risk factors, think about for a moment. How do you push the acid, or not you, but how does the acid go back into the stomach? If you are, the increased risk of this acidity is number one, obesity. Because now you have more mass to push the acid back into the esophagus.
Mm.
Then you have a bulging at the top of the stomach. I referred to this earlier. That is above the diaphragm. The stomach has to be below the diaphragm. There is a bulging on top of the stomach, which is known as a hiatal hernia. Now, I've seen huge hiatal hernias in my practice. And this can, of course, cause pushing off that sphincter, and it relaxes and pushes the acid. Pregnancy, same. There is more pressure. And sometimes when you have food lying in the stomach for a long time, delayed stomach emptying, then you can get this problem or becomes a risk factor. Now, smoking, what can aggravate this acid reflux? Smoking is, is a no-brainer. But what it does is it reduces the effectiveness of the lower esophageal sphincter. Think about it. Many of you must have experienced eating a large meal or eating late at night. Remember, I remember the saying that have breakfast like a king, have your lunch like a prince, and your dinner or your supper like a pauper. But we don't do that. We hardly have any breakfast. We have our cup of coffees and we have a bowl of cereal or something. And then we have a sandwich for lunch because we are workaholics. And then we have a huge meal in the evening. So when you have this huge meal in the evening, then this can cause problems, especially if your eating is at night, at 8 o'clock, 9 o'clock. Generally speaking, they say you should have your breakfast with the sunlight and you should finish your supper and dinner come dusk when the sun goes down. Anyway, eating certain foods, now that comes to mind that all these fatty foods, the fried foods, the meat, your eggs, and your dairy, and your processed foods, and saturated fats, and all these can, even sometimes your caffeine in your coffee, can cause problems as being risk factors for good. And therefore, drinking certain beverages, alcohol for one, and coffee. See, what alcohol and coffee to a certain extent do is it cause the relaxation of that sphincter, the lower esophageal sphincter, and it also increases stomach acid production and slows the digestion. And all these three factors contribute to the acid going up and causing problems. Now, also I've seen this in my patients is when you take certain medications. It can be aspirin, it can be NSAIDs, like non-steroidal anti-inflammatory medications, like your ibuprofen, your Motrin, your naproxen. And I believe that sometimes you can get in your nutrients supplements like vitamin C and iron, which can have some ingredients that can cause this problem. And you can get certain blood pressure medications like your beta blockers or your calcium channel blockers, and that can cause slow down the intestinal motility and can cause reflux. So this is far as the risk factors are concerned.
So,
Now,
Dr. Akil, let me just ask you this. You mentioned about the gut being involved in this as well. Can you kind of paint the picture? You know, you eat the food, it goes down your throat and into the stomach. The acid gets produced and it does its piece as far as digesting food. And then you've got the food that's going into and through the intestines. Now, what you just said is, if I'm hearing you right, that something happens in the intestines that can potentially push the food back up or the acid back up. Or can you kind of go into a little more about how that connection
see, what
works?
happens is your stomach can have the food lying for a long period of time. And sometimes your peristalsis, the intestinal motility, the lower gut, that cannot be that good. And so all these are factors which
Mm,
the acid remain longer in the stomach. And the longer it stays, the more chances of it is to go upwards into the esophagus.
okay.
So the whole idea is that if you follow this, even now, we have not even discussed the treatment, but even now, folks can understand that, and I'm sure that quite a few of us have already experienced this.
Mm-hmm.
And we have got these medications, which is to me, not all, but there's Rolaids and your H2 blockers and your PPIs. Sometimes they are just band-aid.
Mm-hmm.
We figure out of how to avoid the sphincter going into relaxation when it is not supposed to, and how to prevent the regurgitation of that acid.
Mm-hmm. Mm-hmm. That's really good to understand. I don't think that most people even think about the fact that the intestines can play into how the stomach is acting, or that food could remain for so long in the stomach. We always think that the stomach empties out into the intestines, and if it stays anywhere, it stays there. Um, but what are, and you're probably going to get to this, what are some of the foods that actually cause acid reflux, or to for the acid to not create the initial digestion so that it does stay in the stomach like it does?
We will try to talk about this a little later on
Okay.
when I do the food part of it, of how a plant-based food as opposed to the animal-based food. We'll get into it. But right now, look at if you have this problem, and now take, for example, a patient who has come in and has got acid reflux, and the doctor prescribes, say, H2 blocker like your Pepsid or your Exit, and he takes it, he feels great, but he does not change his lifestyle. He eats the same kind of foods which can cause acidity, and then he is now taking all these foods, plus he's taking that medication, because immediately if he gets heartburn or things like this, he will pop in this medication and it will resolve for the time being. But it is causing problems in his esophagus. It is causing inflammation in his esophagus, which he may not realize. And then the stomach acid can break down the tissue in the esophagus. This can not only lead to inflammation, but bleeding, and sometimes it'll form a sore, open sore, which we call as ulcer.
Mhm.
And this is called as inflammation, and it causes pain, and then you start getting the problems of difficulty in swallowing. That's your first inflammation, which can cause also bleeding. Remember that. Now, number two is this acid which is there can cause scar tissue to form. After the ulcers, there's scar tissue, and the scar tissue actually narrows down the esophagus, the food pathway. And therefore, you have further problems leading to swallowing, because now you have a stricture in the food pipe, the esophagus. Now, if the acid continues, then it can change the lining of the esophagus. See, lining of the esophagus is different from stomach. Now the lining of the esophagus can be changed. And these changes are associated with the risk of having cancer in your food pipe, in your esophagus, esophageal cancer.
Mm-hmm.
Now, what happens is that these precancerous conditions, what we call as Barrett's esophagus. Now, once you reach the level of Barrett's esophagus, the whole treatment changes. We don't want it to go there, to be the Barrett's esophagus, whereby now you have a chance of getting cancer of the esophagus. We've got to prevent that. Well, once you get Barrett's, then of course it is in a different ballgame. So my point is that with all these things, how does one diagnose? Most of it is diagnosed by the patients, by the symptoms. And if you take a history, they've been having foods that can cause more acid. So if you look at foods, especially animal-based foods, whether it is your meats or your dairy or your saturated fats and your even vegan, your French fries in oil and your acid producing your coffees and your alcohol, all these things can invariably cause a problem with your it helps you to diagnose it. Oh, I'm having all these symptoms because I'm having all these things, and now I'm getting in heartburn. So the very fact that if you stop eating this food, then obviously you will be in a safer place in terms of not getting the symptoms as much as when you're having the other foods. Now, once you I have to warn one very important thing over here, that once you get heartburn and you get chest discomfort, remember one thing. I've talked in my previous talks on heart disease that this can be a symptom of heart disease. So if your symptom comes out of the blue, which is not usually there. Now, if you are a person who is taking all this caffeine and foods that I just mentioned, and you're getting heartburns, and then you take some Rolaids and it disappears, that is your acidity, acid reflux. But if it comes out of the blue, you've not had these problems, you've been eating a reasonable diet, and suddenly you get this heartburn, then you should be careful, because this can be one of the symptoms, vague symptoms of heart disease, especially in women. So this is a time that this becomes an emergency. It means now you've got to go to your doctor, say this is happening, and I need to have a cardiac evaluation done. So remember this, that sometimes I've seen so many of my patients having heartburns when they actually are having a heart attack. So be careful on that grounds.
It's interesting how heartburn and a heart attack can look so much alike. Is there something that you would be able to tell that it's heartburn instead of heart attack?
Yeah, I guess, you see, what I'm trying to say is that if it is an ongoing thing, whereby you take Rolaids or you take your Pepsid and it disappears, and you know you've been having this for quite some time, that's different. But out of the blue, if sometimes you're sitting over there and you're getting heartburns and you don't know, and especially if you've got a chest discomfort and if it's a radiating kind of a thing, this is out of the blue. You have not experienced this. That is the time you should talk, you should go to the emergency room, or what have you, and get your cardiologist or your primary care involved in your evaluation and treatment.
Mm-hmm.
But other than that, you see, these are not the typical uh, Hollywood type of heart attacks. So if you are at an age which is, say, over 45, 40, 45 plus, over that age, and you have been reasonably in not having much heartburns or things of that nature, and then suddenly you get this heartburn, and that's serious. That is to be taken seriously. But we are talking about the reflux, which is ongoing, which is causing problem in your esophagus, which can cause inflammation, which can cause strictures, which can cause difficulty in swallowing and whatnot. And then you can get the precancerous condition of Barrett's esophagus. So those are the things that I'm talking about. Now, if, for example, uh, if you see, if you want to confirm this diagnosis that now your esophagus is inflamed, or you want to check for complications, whether there is an ulcer or bleeding or whatnot, then they may go in for an upper endoscopy. This is when they put a tiny camera on the end of a very thin, flexible tube to examine the digestive system. So it views what is going on in your esophagus and stomach. Now, when they're viewing this through the endoscope, they may not see reflux, but they can see what it has done. That there is some kind of a stricture or that needs to be treated, or if they want a certain suspicious area, they can do a biopsy with this endoscopy. And if they're suspecting, like, say, that precancerous Barrett's esophagus, and then sometimes when you, because of the strictures, the esophagus is narrowed down, it can be stretched and dilated to help swallowing better, and that can be done through the uh, endoscope. Now, there is also another thing which I think most of the GIs don't do it, is X-ray of the upper digestive system, where you take this yucky, chalky liquid that coats and fills inside the lining of your digestive system, correct? And it allows the radiologist to see your esophagus and stomach, and helpful for people who have trouble swallowing. So there are other tests, but we do not have to need to go into that. So these are the things that are done mostly by the GI. In fact, the endoscopy is the only thing which I know the GIs will do immediately.
Okay.
And therefore, we come to the most important thing. Everybody not everybody, most of us have had some time or the other heartburn, acid reflux, and therefore, what is the treatment? Do you just jump and get your Rolaids, or get your non-prescription Pepsid or your Prilosec, or do you think there is something else that needs to be done before you embark on this for acid reflux? And trust me, it is the lifestyle changes which can prevent you and even treat acid reflux. So that, and it may help you to reduce the frequency also of acid reflux, and then helps you eventually. Like what? Maintain a healthy weight. As we said, the more extra pounds, it puts pressure on the abdomen, pushes up the stomach, causing acid to reflux into the esophagus. We talked about it. Stop smoking. It decreases the lower esophageal sphincter's ability to function of closing and relaxing as it is supposed to do. Now, elevate the head of your bed. If you regularly experience heartburn while trying to sleep, raise the bed by placing some board or whatever, I don't know, but about 6 to 9 inches. I read someplace that if you raise your head with additional pillows, it is not going to be effective. So you actually need to raise the head side by about 6 to 9 inches. Now, they also say that start when you're sleeping, sleep on the left side when you go to bed, because lying on your left side makes it less likely to have reflux. I don't know about you folks out there, but I have had this problem in the past lying down after a meal. They say that you should at least have 3 hours before you go lie down or go to bed. After eating, 3 hours. Then, very, very important, but not very many people put a stress on this. Eat your food slowly and chew it thoroughly. They say that you must take a morsel of food and chew it for about 30 seconds. I would say that if you are eating with your hand or your fork, put down the fork after every bite and then pick it up again once you've chewed and swallowed that bite. Now, I know as doctors and residents and people, nurses, nurse practitioners, we've all been trained to go to the floors and look at our patients and do nighttime calls, and we have learned how to eat fast and not really chew over food. So I believe that you should take time to do that. And don't consume foods and drinks which obviously will cause a reflux. Meat can do that. Alcohol can do that. Chocolates can do that. Caffeine can do that. Fried and fatty foods can do that. Sometimes, individual to individual, is citric fruits, like oranges and all that, can cause problems, pineapples. And then finally, don't wear tight-fitting clothes around the waist. Because again, it's the same thing as putting more pressure on the abdomen and more pressure on the lower esophageal sphincter. So we then come to these are your treatment at any given time. If you follow these things, what I've just mentioned, you may not have to go in for medication. Even if you have to go for medication, you don't have to use it for more than a month or two. You cannot use it for months and years together. So we come to medications. Normally, I don't speak about medications in my talks, so please go to your doctors, and I'm only giving you my suggestions, evidence-based and science-based and my personal experience, but please ask your doctors if you want to make any changes. So what happens? Let's look at non-prescription, over-the-counter, antacids, calcium carbonate, Mylanta, Tums. It may provide very quick relief. Taking it once in a while, it seems okay. But they are not going to sort of heal an inflamed esophagus if you're not going to do the lifestyle changes along with it. Now, overuse of these antacids, because remember, it is calcium carbonate. So you may get into diarrhea, and sometimes in the long run, if you use it ongoing, it can have some renal kidney complications. Now, this is the one which can provide quick relief. And the next line of medications are your H2 blockers, the histamine blockers. This is the old one which we used to use years back was Tagamet. It is not taken off the market, I believe. The ones which are used very often are the Pepsid and the Exid. They don't act as quickly as antacids, which we talked about, but they provide a longer relief. They decrease the acid production for up to 12 hours.
Mm.
Now, stronger versions are available of this, which becomes prescription medication. But these are non-prescription. What happens is these people can get it over the counter and they just use it ongoing. Now, this reduces acid production. Now, the next line of medication are the ones proton pump inhibitors called as PPIs. They are stronger acid blockers than your H2 blockers. And this gives time for the damaged esophageal tissue to heal. So the non-prescription ones, the same as a prescription one, lesser quantity, Prevacid, Prilosec, and Nexium. But 1 month, 2 months, maximum 3 months, even if you've got esophagitis or inflammation of the esophagus. And then when you start using all this, talk to your doctor about it, that you are using over the counter, and see what he has to say. Now, prescription medications are the same ones. Your Protonics and your Prilosec and your Prevacid and all this which we mentioned.
Mm-hmm.
If you look at the PPIs, which is used like every people who have this and use it for years on, they are well tolerated, but that can cause diarrhea, headaches, nausea. These are immediate. But in certain instances, low vitamin B12, as it can cause achlorhydria, meaning no acid in the stomach. And they can cause lower levels of magnesium. And serious side effects have been noted with these medications of PPI, like bone fractures, GI cancers, renal disease, kidney disease, pneumonias. So, and I don't really think that this should be used more than 1 to 2 months. Idea is if you have got certain kind of gastroesophageal reflux disease, use first of all Pepsid or Exid for say a month or 2 months, and then do the lifestyle changes, and I'm sure you'll be on a path to recovery. So the next question obviously comes around is to why do we think that whole food plant-based diet, does it help in preventing and treating gastroesophageal reflux disease? See, the whole food plant-based diet, it emphasizes on natural foods. So you have minimum processed foods in it.
Mhm.
And if you have this, and which can manage and alleviate the symptoms of acid reflux in several ways. You see, you have a lower fat content in whole food plant-based food. That there's a high fiber content, which can absorb stomach acid and reduce the incidence of reflux. And most of the plant-based foods are alkaline in nature compared to animal and processed foods, uh, which can then potentially help in neutralizing the stomach acid. And if you have a whole food plant-based diet, you're also controlling your weight because you're nutrient dense foods as opposed to calorie dense foods. Now, there are patients, even on plant-based foods, they get uh, some of them acid reflux. And so what I tell them is that especially during the nighttime, these are the people who get nighttime reflux. Cut down your plant-based protein at bedtime, like your tofu, your tempeh, your nuts of any kinds, almonds or cashew nuts or your pistachios, and take soups for the evening meal. Slow glycemic carbs, raise your sugar very slowly, and non-citrus fruits. These are the things you should be taking initially, and so that you can heal your inflammation. Uh, some studies have been done. Turmeric, for example,
Mhm.
uh, is as good as PPIs. Uh, yeah, and that's the one that comes to mind. So with that, I think it is already 12:51. I will end and I will open for questions.
Well, first of all, thank you. That was some very interesting information. And while we are having people to either raise their hand or put their question in chat, I'd like to ask a question. And that is, first of all, where does the belching and the burping come from?
Yeah, these are the entrapment of the gases that is built up bloating, and therefore you try to release that pressure by the belching, and it's a regurgitation of the gas, so to speak, that comes out. So this is again overeating, kind of foods that you eat. You've not chewed your food well. You've taken a lot of alcohol. You've taken a lot of meat-based products. This will cause. And you have lied down too soon after your heavy meal. Will always cause this kind of belching and even a lot of gas being formed. When you eat slowly and you chew your food and you keep your mouth closed, there's not even air swallowing so much.
Mm, mm-hmm.
Something that I have noticed, that a patient of mine told me that every time he eats after when a ball game or something, when he's not aware of what he's eating and how, and then he gets a lot of stomach distension and belching and flatulence.
Mm-hmm. Mm-hmm. Well, that's good to know. And this is if you're doing a lot of belching, and the first thing that you maybe want to think about is, are you chewing your food? Are you eating slowly, chewing your food and giving yourself time for those acidic fluids to actually start working? Is it also, if it's something that you do on a consistent basis, is it also like a precursor sign of potential acid reflux or no?
You will bound to get it when your diet is not healthy and you're sleeping. You'll start getting those mild heartburns. and then that becomes a little more severe, and then you try to change your diet, but you don't do that. What you do is you immediately fall back upon the medication, which is so easily available. I believe that people should not resort to these medications as a first line of treatment for acid reflux. And therefore, there's $1 billion industry in this. So
Mhm.
how you hear on the TV all the ads going for Nexium over the counter. So it's okay to use it for a short period of time. But if you get this kind of uh, heartburn or the backflow of that bitter liquid when you're lying down, these should be kind of warning signs that, hey, there's something wrong and I should do something about it.
Mhm.
So
Mhm.
my point in treating is when you feel this and you know this, and if you want to go, of course, go to your doctors and all that. Nobody stops you from that. But if you are pretty sure you're a young person, you're pretty sure this is it, then use a little bit of Pepsid or Exid for a while. And but my main thing is you can use this and you feel better. But if you don't change your lifestyle, you'll be hooked on this. You'll be addicted on this. Well, if you change your lifestyle and then follow with this for a month, then there is every chance that you will not need the medications and you're going to be free from acid reflux.
That is so good to know. And when you're talking about lifestyle changes, tell us a little bit more about what can be done. I mean, even just go through the 6 pillars of lifestyle medicine again so that we can get that reinforced.
Yes, to be very honest with you, I have a belief that everything can help your foods. First is your foods, and if you look at the alkaline nature of whole food plant based as opposed to the acidic nature of animal foods, that can help. We talked about the weight maintenance. This is all nutrition. We talked about the fiber and the low fat content in whole foods. That is important. Then you have trigger foods, acidic foods, all that spicy foods. Some people don't tolerate it well. So caffeine, for example, if I take spice, I don't. I'm not saying I'm against spice, but for me, it causes problems. My wife, it will not cause problems. So I have to be careful in what citric fruits can cause problems to some people. So avoid those. And then you do find that exercise can help because it reduces body weight and cause decrease in abdominal pressure, obviously. It improves digestion, speeding up digestion, exercise or activity, and it reduces the time the food stays in the stomach. And then, of course, you have the stress reduction. Can increase stress can increase the perception of good. And when you are stressed and you don't do anything about it, you tend to eat more. You tend to eat more rubbish, and that causes your reflux. Uh, Certain exercises should not be done immediately after food, like even otherwise, which involves bending, whereby abdominal crunches, abdominal pressure, those should be not done as far as the reflux is concerned. And therefore, your timing should be at least 2 hours before eating exercise and low impact exercises, not exercises that increases the abdominal pressure. Stay hydrated. It dilutes the stomach acidity. So, and then your body positions that we talked about, sleeping on your left side, And then you have sleep, and sleep can also help. If you get a good night's sleep without the regurgitation and all that, it can help. And we have more so is uh, stress we talked about. Then avoiding substance abuse. We talked about alcohol, and we talked about calcium medications like beta blockers. We talked about smoking and all these anti-inflammatory drugs. And therefore, so and then and then finally, your important thing is that it can mimic heart attack or heart disease. So be careful on that ground. But I think if you follow all these, reduction of stress, exercising, sleeping well, yeah, eating better, a whole food plant based preferably, and all these things would
Mhm.
help.
Great, great, good to know. And thank you. That was a very nice explanation about how each piece actually contributes to the health and healing. Now, there is a question from Pam. Have there been any recorded cases of healing to any degree with Barrett's esophagus?
I think it is a precancerous situation. So if you start following the lifestyle changes and take your PPIs for a period of time, which depends on your GI, 3 months or longer, in case of Barrett's, there's a good chance that it will not turn into cancer.
Great.
Very good chance.
Right. You know, we always like to hear the hopeful information as well as the, you know, recorded cases showing that a life can be improved when you're eating a whole food plant-based diet and living that lifestyle. And if there are no other questions, I am going to actually bring everybody out. And what are your final thoughts for everyone for today, Dr. Akil?
I believe that we as a nation, we are overusing our uh, H2 blockers, Pepsid, Nexium, all those PPIs and Rolaids and all we are taking like candies. We should stop doing that because it creates more problems in the long run than benefits. That's my number one. Number two is if you get into a better lifestyle, then you will not have these problems. You may not have to resort to all these medications. Now, there are certain situations when you have very high acidity. We don't want to go into it, Zollinger-Ellison syndrome, whereby, of course, it's a different thing, and that you may require a lot of PPIs or a longer period, but those are rare cases. We are talking about in general, your acid reflux, your GERD can easily be taken care of with lifestyle, with a certain amount of medication. And if you have certain things like your huge hiatal hernia, you may require surgery. And if it is bleeding and all that, you may require aggressive therapy at that time. But we don't want it to go there. So please stop taking those medications just because they're available over the counter. They are the same medications in smaller doses, but the side effects are the same in the long run.
Mm-hmm. Mm-hmm. And it's key that people know this. Sometimes we are so used to seeing what's been introduced to us and doing it ourselves that we forget that masking the symptoms for an extended period of time only creates more problems.
And one last thing, that if you are taking something right now, and just because I've told you, oh, this is, don't go straight away and stop taking it. please discuss with your doctor, because I don't know what an individual has, whether it is a precancerous Barrett's, or is just acid reflux, or it is gastroesophageal reflux disease, or what have you. So discuss with your doctors, but keep in back of your mind, somebody who is having these refluxes and acid reflux, they can be helped if you pass this message around.
Mm-hmm.
Spread this message.
Well, thank you, everyone. Unless there's another question, something just came in. Let's see. Um, Francine says she's not had this condition, but she regrets that there's so many advertisements that offer a short-term quick fix solution in the form of pills. The evidence seems clear that lifestyle interventions are the real cure. And this is such an egregious state of affairs here in America that we will put a pill on top of something versus looking at what the cause is and working on creating a better way of life that makes this go away. So thank you very much. Thank you, everyone, for joining us today. Dr. Akil, we so appreciate you. Uh-huh.
I couldn't agree with you more. You're absolutely right about what you just said.
Mm-hmm. So thank you for that as well. Okay, everyone, we will see you in June. Keep an eye out for your emails. We'll be getting in touch about what the subject of the June talk with the doc is. And we will probably have another presentation and then open time for your Q&A. Thanks for joining us, everyone, and have a wonderful weekend.